On the night team, a new study is breaking down health disparities right here in Jefferson County, looking at historical factors and focusing on the solutions. A panel tonight discussing its findings.
It is a heavy lift, and it's going to have to be from the bottom up and the top down, and all of us have to play a part.
WHS 11 Night Team's Bobby McSwine sat in on this conversation, and she is joining us live in our newsroom with more on this very important issue and discussion. Bobby, what did they say tonight?
Well, Doug, that study that is done by AARP focuses on Louisvillians 50 and older and looks at the root causes of health disparities in the city's Black community. From housing to food access, panelists say it really comes down to life experiences shaping these outcomes.
We're keenly aware of the fact that there are long-standing systemic inequities.
Inequities that have caused health problems in the Black community for decades. A new AARP study breaking down the issue. The African American Initiative and WLOU Radio discussing it live on Monday with AARP, along with community members, including a pastor and doctors.
Our roots are planted in soil that we call systems of power.
Those systems include employment and income, housing, transportation, and more, of which panelists say redlining can be attributed as a catalyst to the disparities because access was shut off, access to fresh food, clean air, and proper infrastructure upkeep. According to the study, white people exceeded the life expectancy in Jefferson County, while Black Louisvillians lived 3 years less, and that age is even lower for Black men. While panelists agree that the past has affected the present, they also say the Black community has to change its eating habits and other cycles that perpetuate unhealthy lifestyles.
This report is extremely important, but what we've got to do is we got to make sure that we get it out to the public and we get it out to those, especially in our listening audience, and let them know, hey, this is where we are, this is what we need to do, and this is what is going to be done.
Senator Gerald Neal, the founder of AAI, says he hosts these kinds of discussions because it's his responsibility and can help shape policy.
My thing is to bring value back to my constituency base, to bring value to my community.
Neal says one discussion point he was excited about is the idea of a report card, giving a grade to various organizations to assess how they are closing that health gap. He says this will increase transparency and engage the community. I'm live in the newsroom. Bobby McSwine for the WHAS 11 Night Team on your side.